Hello, everyone. I come to you again this week with some new data, some points of interest you all should know about, and a way that we are going to unpause, hopefully starting next week, May 15th. Data throughout our county is confirmed cases, 3,233. Our total tests administered, 17,477. And our town of Dover has lowered its cases down to 36. With that information, the Dutchess County COVID-19 dashboard has been updated. This is the website, the county website you can go to, and you can look at the towns, the numbers that I've had, the cases, the tests administered, etc., etc. Effective May 8th, 2020, Dutchess County's COVID-19 Community Impact Data Dashboard will reflect new source data for several key data points, including deaths. The dashboard will use data from the New York State Department of Health to report total number of confirmed cases, tests completed, and total deaths. The change comes following a large influx of fatality data received this week, primarily reported by local hospitals, that significantly increased the total number of COVID-19 related deaths to Dutchess County. They feel that you'll be better informed. They've updated it. They've made it better, were his words. Dutchess County's COVID-19 Community Impact Data Dashboard will continue to be updated daily following New York State's Department of Health data updates. Again, these changes were made to help better inform you, the residents of Dutchess County, and you, the residents of the town of Dover. Along with that, May 15th, the day that is scheduled by our governor to hopefully start unpausing the state of New York, reestablishing our businesses, opening them up, making it better for them, restart our economy. And with that comes a few things that we need to know about. First of all, we encourage all businesses in the town of Dover to go to DutchessBNN.com. That is Dutchess County's website for businesses. I've said it before, it gives you the information that you need to obtain to help your businesses restart or get back to somewhat of a normal everyday process. These updates can also be found on www.governor.newyork.gov. You'll be able to read everything that I'm going to say to you right now. You'll be able to read a little bit in depth instead of just hearing my highlights. I urge you all to look into this. Go to the website, see what's going to be done and what needs to be done. CDC guidelines. They're based on the CDC recommendations. Regions must experience a 14-day decline in hospitalizations and deaths on a 3-day rolling average. Regions with few COVID cases cannot exceed 15 new total cases or 5 new deaths on a 3-day rolling average. A region must have fewer than 2 new COVID patients admitted per 100,000 residents per day. I explained earlier in the last couple of updates. The state is divided up into regions, some less, some more in the number of cases. The ones with less will open quicker, faster, and probably more efficiently. Those with more cases, it will be a slower process. Priority industries for reopening. Businesses in region will reopen in phases 1 through 4. Phase 1. Construction, manufacturing, and wholesale supply chains. Select retail using curbside pickup only. Phase 2, professional services. This has not been determined yet, but this may include haircutting businesses, nail salons. If this is entered into phase 2, you are looking at a mid-June to end of June timeframe. Professional services, finance and insurance, retail, administrative support, real estate and rental leasing. Phase 3, restaurants and food service, hotels and accommodations. Phase 4, arts, entertainment, and recreation. Certain precautions. Adjust the workplace hours and shift design to reduce the density in the workplace. Enact social distancing protocols. Require all employees and customers to wear masks if in frequent contact with others. If in frequent contact with others. Healthcare capacity and testing. Building healthcare capacity. Testing regimens. Tracing system. Isolation facilities. This will be determined by your state and your county and handed down to your towns. Regional coordination. Reimagining telemedicine. Reimagining teleeducation. These are all things that will be talked about in the upcoming weeks. Things will be emphasized. Things will be enforced. Changes need to come to make everything safe, everyone better, and everything safe for everyone within it. For our town of Dover, we will plan for the unpausing based on state and county protocols. We will be reestablishing our businesses, getting back to somewhat normal's way of life. Businesses at the town hall will resume with a tentative date of June 1st. We will be making changes for our workers and you, the public. And hopefully, with a tentative date, June 1st, we will be back in full business here at Town Hall. Our highway department is planning on going back full duty, full staff, next week on the 12th of May. We will also be discussing this week about the opening of certain areas throughout our town, our parks, our hiking areas, and those attractions that bring people here to Dover, but also entertain the residents of Dover. All precautions will be taken. All safety measures and recommendations will be posted. I will say next week may be one of the most important updates I have given. Information, schedules, and the openings of areas in our town. Hopefully, I will all be able to relay to you. Today was a day of work all day, but it was a day of joy. I need to thank everyone who had a part in today's events. We, the town of Dover, elected officials, business owners in the town of Dover, we all delivered 250 lunches to the Sharon Hospital workers. This was made possible by donations from residents of Dover. And a special thanks to Rennie's Store for organizing the lunches, along with Freshco 22 for also putting over half the lunches together. We picked them up at both locations. We delivered them personally to Sharon Hospital. They were very appreciative, and they thanked us. 250 lunches, 15 cases of water, 250 bags of potato chips. I thank you all very, very much. Mission accomplished. And it was very overwhelming when the gentleman just couldn't say thank you enough. It was an honor. Thank you all who donated to our food drive this past week. The food pantry will be very happy. We have more to here than we can count. Our town hall is full. We have so much to give away. It's truly incredible. We had over 30 cars today come by here at 3:30 this afternoon. Teachers from the Teachers Association of your Dover schools. They brought items for our to our town hall to bring to the food pantry. I'm proud of what our residents of Dover, the Teachers Association, and anybody else that I haven't been told about. I'm proud to be a member of Dover, a resident of Dover, and your supervisor. I can't thank you enough. With that, this being a short week, I have a quote. And as we are going into a change, going into a different norm, as we say it each and every day, coming out of a situation that has changed things permanently. or hopefully just for a little while. I read you this quote. And once the storm is over, you won't remember how you made it through, how you managed to survive. You won't even be sure whether the storm is really over. But one thing is certain. When you come out of the storm, you won't be the same person who walked in. Author is unknown. I leave you with this as always. Please remember to keep the social distancing, the hygiene practices, wear your masks, your gloves, wipe down everything, disinfect it. Only go out when you truly, truly need to. And as always, we are Dover. We are strong. We are Dover strong. We are one team, one town, the town of Dover. I wish you all well, stay safe, and most of all, please, please stay healthy. Thank you, everybody. Good night. And hashtag Dover Strong. Thank you.